The hearing of the Health Subcommittee is called to order, and I'll start by recognizing myself for an opening statement. Today we are meeting to examine a discussion draft on comprehensive health reform. The subcommittee will also convene to receive testimony tomorrow and Thursday. In addition, the full committee will meet tomorrow morning to hear from the Secretary of Health and Human Services, Kathleen Sebelius. Comprehensive health reform is a goal that has eluded reformers, Democrats and Republican alike, for over a century. As a result, the problems that plague our healthcare system have continued to grow worse. The ranks of the uninsured continue to swell. The cost of insurance and medical care continues to skyrocket. The quality of care delivered becomes more and more erratic. After years of failing to address these problems, we find ourselves in a situation where our broken healthcare system is a clear and present danger, in my opinion, to the economic health of this nation. Government budgets are being overrun by the mounting cost of healthcare, crowding out funding for other key services. American businesses are disadvantaged as they try to compete in the global marketplace. And American families are being driven into bankruptcy by ballooning medical debt or foregoing critical care altogether. President Obama understands that these problems require urgent action, which is why he has called upon Congress to pass comprehensive health reform legislation this year. And health reform is an issue that generates great interest and controversy. That certainly we know. And while we may not all yet agree on a common solution, I think we also know that we can't let this opportunity pass us by. Maintaining the status quo and allowing these problems to continue to fester is no longer an option. Nor can we simply resign ourselves to making marginal improvements as we've done in the past. The time has come for comprehensive reform, and the discussion draft we are reviewing this week is a starting point for that debate. The discussion draft envisions a world where every American family has access to affordable and quality health coverage. Those who are currently unable to access coverage through our public programs, employers, or the individual market will now be able to do so through a reformed insurance marketplace that guarantees access, quality, and affordability. People who already have health coverage will be able to keep their coverage and their choice of doctors. But health reform isn't just about improving coverage and access. It's also about improving the public health. Too many people are suffering from preventable illnesses and conditions such as cardiovascular disease, respiratory diseases, and obesity-related illnesses. Accordingly, we must change the way we think about medical treatment by focusing on preventative care as well as the quality of care being given, and this discussion draft aims to do just that. There are a lot of other important details about the discussion draft that I'm not mentioning, which I hope will be explored over the course of the next 3 days. I just want to speak directly to those who will stand in opposition to our efforts. For those who have legitimate concerns with the draft, I simply urge you to talk to us about your ideas. We want to work with those of you who are truly interested in being constructive participants in enacting health reform this year. But for those who stand in opposition simply for opposition's sake, I urge you to rethink your position. After a century of inaction, the American people want to see change. They want to see health reform enacted, and we intend to deliver it to them. Thank you. And now I'll yield to our ranking member for the day, the gentleman from Texas, Mr. Burgess.
Thank you, Mr. Chairman. You know, it seems like I've been waiting my entire career for just this time. I gave up 25-year medical practice to run for Congress, and I didn't do so to sit on the sidelines with really what could be the biggest change in our system since the enactment of Medicare almost 45 years ago. And here we are this morning calling up 10 panels to walk us through a legislative proposal released late last week, and it's pretty skimpy on some of the details. Now, I recognize what a draft is, and I understand that a draft means that everything is not completed. But for a draft that mentions fee 54 times, tax 58 times, and penalty 98 times, isn't it odd that we have nothing as pertained to the financing of this legislation? So, Mr. Chairman, will we have a legislative hearing on the actual bill that this committee might mark up when that bill becomes available? You know, I feel like we ought to emphasize the care part of health care, and this debate continues to be defined by two words, cost and coverage. Yet we neither know how many people will cover under this proposal or how much it will cost or how we're going to pay for it. Mr. Chairman, will you commit that we will at least have a CBO score on the bill that we will mark up, since we do not have one on this bill? Now, even if the CBO were here to testify, which they're not, Will they be able to tell us how much this bill will cost in the out years? Every change in the tax code, every cut in spending that achieves savings only gets us out 10 years. From there on out, it will mean Congress will be having to find tens of billions of dollars a year to keep whatever program we enact to keep that going. And most importantly, as I've said, coverage does not equal access. What does this bill do for patients? What does this bill do to ensure that we'll have an adequate supply of physicians? Now, Mr. Chairman, the President said in his breakouts, after one of the breakout sessions last March, that he just wanted to find out what works. He said it again at the American Medical Association last week. I applaud him for having an open mind. I wish this committee had the same type of open mind. You just said you want to work with people who are willing to work with you. Why then, Mr. Chairman, have we been excluded from the drafting of this bill only to receive it, again, late last week and in a very incomplete form? Now, I was hopeful, and I'm still hopeful, that we could write a bipartisan bill. Since no Republican has been consulted thus far on the totality of this bill, I think that's a disservice to our constituents. I think that's a disservice to Americans. Mr. Chairman, we do stand ready to work with you when it's possible, and when it's not, we stand ready to try to educate you where you're wrong. And that's what this process should be about. But it should be done in the arena in the full light of day and not behind closed doors in the dark of night. That's how our constituents are best served. That's how the American people are best served. And certainly for America's patients and doctors, we should do no less. I'll yield back the balance of my time.
Thank you. Now, I just mentioned Dr. Burgess was sitting in as the ranking member, so I gave him the 3 minutes or close to it. But because we want to hear from the witnesses today, and we have so many, I'm asking members to try to limit their remarks to 1 minute today. I don't know if you hopefully got notification of that. Because remember, not only are the health subcommittee members able to participate today, any member of the Energy and Commerce Committee is able to give an opening statement or participate. So that's why we limited it to 1 minute. Next is the gentlewoman from Colorado, Ms. DeGette.
Thank you, Mr. Chairman. I'll just point out to my friend from Texas, here we are in the light of day, and we're going to have 3 days of hearings on this draft, and I want to thank you, Mr. Chairman, for doing that. This is a monumental undertaking, and it's going to take everybody's wisdom and advice. I want to talk about a couple of things that we all care about in this bill. I think we're all going to have to do that today because it is such a comprehensive bill. First of all, automatic enrollment of newborns into Medicaid will ensure that all children have access to necessary immunizations and well child visits during the first and most important year of life. Secondly, primary care workforce incentives and training programs like student loan repayments and higher reimbursements for primary care will help with the workforce we need. And finally, a strengthened infrastructure for healthcare quality will let us identify and track key health indicators. I want to agree with you for the need for prevention, and I just want to close by saying we're either going to pay now or we're going to pay later, and I suggest that we focus on Americans' health. Thank you, Mr. Chairman.
Thank you. Gentleman from Georgia, Mr. Gingrey.
Thank you, Mr. Chairman. Mr. Chairman, I want to ensure that every American has quality health care. Unfortunately, this legislation will do nothing but ensure that millions of Americans lose the coverage they currently have. By including a government health plan and a mandate that every American purchase health insurance, this bill guarantees that the only insurance plans available to Americans and businesses are those that are designed and sold by government bureaucrats. For those that argue that the government plan will merely compete, studies have shown that such a plan will drive out competition and indeed become a monopoly. This, the bill before us argues, is the responsible thing to do. By way of government-made products, mandates, taxes, and partisan politics, this legislation will take quality, market-driven health insurance away from millions of Americans and lead inexorably to a single-payer national health care system. We can do better, Mr. Chairman. The minority party has some well-studied ideas for improving the affordability, the access, and availability of health care. So far, the majority party in the House has turned a deaf ear toward working in a bipartisan manner. For the sake of the American people and those patients I cared for for over 30 years, I urge you to listen carefully to all voices. And I yield back.
Thank you. Vice Chair of the subcommittee, the gentlewoman from California, Ms. Capps.
Thank you, Chairman Pallone. Thank Chairman Waxman and Chairman Emeritus Dingell for your excellent leadership and the hard work that you and your staffs have put into this draft legislation. As a nurse turned Congresswoman, this debate is one I waited for a very long time. We've had many hearings on this topic, bipartisan hearings, and I thank you for that opportunity that it really, truly is coming from all the people we represent. Our nation's healthcare system is in shambles, and with this legislation, we'll finally take the most important steps we can to fix it. We will put the emphasis on wellness instead of on illness. We will give patients greater choice and protection in the health insurance market. We will make sure that everyone has access to the care they need and deserve. It's going to take a long time, some difficult choices, and perhaps a few pennies to get it underway. But we must act, and we must act now. The price of inaction is simply too high. I look forward to this coming week and the discussions we'll have on how to perfect this legislative proposal. I yield back.
Thank you. The gentlewoman from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. As I have said so many times in this committee, what is on the table for us to consider is, in essence, the Tennessee TennCare experience all over again. And for those of you who do not know, that was Tennessee's attempt at an executive order program of the governor's office. This was their attempt at Medicaid managed care. That plan is what our Democrat governor in Tennessee recently called, and I'm quoting him, a disaster, end quote. Eventually, that program consumed every single penny of new revenue in our state. I was a state senator tasked with funding that program. That program nearly bankrupted the state of Tennessee. It is not a model for future success. It is a model for a looming fiscal disaster. And I have no clue who the majority thinks is going to pay for this thing. I have no idea where they think they're going to get the money for this. Let me tell you, go look at the TennCare records. We cannot afford this program. There is no money to pay for it. You cannot borrow enough money to pay for this program. In Tennessee, we know that this public option always costs more than initial projections. Cost overruns were through the roof. Patients are always going to choose free rather than out-of-pocket care. Employers will force their employees onto the system. That is why you're going to see more than 120 million Americans moving off of private insurance if this goes through. Sound the alarm bell.
Gentlewoman, I
not,
just wanted you to know you're a minute over, so we got to.
Well, Mr. Chairman, I thank you for that, and I think this is an incredibly serious situation. I thank you for your patience.
Thank you. I'm trying to keep people to a minute. I'm not going to stop you if you go a little over, but all right. The gentleman from Utah, Mr. Matheson.
Well, thank you, Mr. Chairman. I'll do my best for the minute. You know, we use the terms cost, access, and quality a lot around here, but we really do need to focus on all three. That's what we're trying to do here. I think this is the most complex piece of legislation we're going to work on in our careers. And the status quo, just maintain the status quo, is not an option. Our healthcare system is driving up costs in a way where both in the public sector and private sector, we can't sustain the path we're on. I fear this discussion has focused so much on access, we're not also looking at the unproductive system we have now. There's so much money in our healthcare system today that is spent in irrational ways. There's so many perverse incentives built into our healthcare system. And if we want to achieve what our president has asked us to do, which is to bend the curve, the cost curve that plots where costs are going, if we want to achieve that, that's where we can really accomplish something as a group. So I encourage this committee, as we look at this legislation, to look for ways to make our healthcare system more efficient, get rid of perverse incentives, and if we do that, I think we'll secure a better future, regardless of how else we structure the plan. Thanks, Mr. Chairman. I'll yield back.
Thank you. Gentleman from Pennsylvania, Mr. Murphy.
Thank you, Mr. Chairman. And I'm thankful we're finally moving forward on this. Certainly there's not a member in this room on either side of the aisle, no matter what one's political leanings, who is not totally dedicated to reforming our healthcare system, and as many of our witnesses are too. The question is which direction. For the time I arrived in Congress in 2003 and during my time before as a state senator, I focused my energies on trying to reform this system. Just in the issue of hospital-borne infections alone, since I've been in Congress, 350,000 people have died, hundreds of thousands more from other errors, and we have spent hundreds of billions of dollars in wasted health care. Our current system of $2.4 trillion wastes about $700 billion a year. Our Medicare and Medicaid system are filled with problems. We need to address those first. But don't take my word for it. Take members of Congress' word for it. In the 110th Congress, 452 bills were brought forward by members of Congress to reform Medicare and Medicaid. Members of Congress signed up to co-sponsor those 452 bills 13,970 times. Members of Congress think we have trouble with the federal government's going to run a health care system. We're not there. A bill that looks at who pays for premiums and co-pays is not health care reform. A bill that looks for taxes to pay for these things is not health care reform. A bill that reduces costs by reducing payments to physicians and hospitals is not health care reform. We have to reform that system. We have the talent and the ability to do that, and I hope that as we progress in the coming weeks on this healthcare reform system, we truly can look at focusing on outcomes and not quantity, and really make healthcare more affordable and accessible for millions of Americans who right now can't afford it. Thank you, and I yield back.
Thank you. The other gentleman from Georgia, Mr. Barrow. Ms. Gentlewoman from the Virgin Islands, Ms. Christensen.
Thank you, Mr. Chairman, and I want to begin by using this opportunity to recognize the fair and open way in which Chair Emeritus Dingell, Chairman Waxman, and you, Chairman Pallone, have conducted the process of getting us to this point today, and to thank you and your staff. The bill acknowledges that insurance is not enough and takes steps to promote prevention and wellness, to expand services, and to eliminate health disparities. We appreciate and applaud your efforts, but if we're to truly transform our system, we will continue to push the committee to go further. One specific area where more progress is needed is in the treatment of the territories. Just as we willingly and proudly fight and die in every war and conflict in defense of our nation, we believe that we deserve the same access to health care as every other citizen and legal resident of the United States. We understand universal health care to mean universal health care. And finally, I believe that the health and well-being of every person living in this country is important enough and vital enough to our nation's productivity, competitiveness, strength, and leadership that passing a meaningful and effective health care reform bill should not require an immediate offset for every provision. Prevention saves. It saves lives, first of all, and it saves money as well. Thank you, and I yield back.
Thank you. The gentleman from Ohio, Mr. Space.
Thank you, Mr. Chairman, for your time and your tireless work on behalf of American consumers. We stand before a debate so historic and significant that it arises but once every several generations, and at stake is an issue of no less importance than the health of the American citizen, along with the health of the American economy. For even though we boast of the most sophisticated healthcare technology and talented healthcare professionals in the world, their services are often out of reach of the average working American. Today I offer three areas of critical importance where improvements must be made. First, we must grow and nurture our rural health care workforce to ensure the same quality of care is offered to all residents of this country, regardless of where they reside. Second, we must make quality, affordable health care a reality for every resident of this country by making reforms that capture the power of the free market, harnessing what's best about market forces. And third, we must change how we treat chronic diseases, taking more steps to encourage prevention and managing care of those that they afflict. An investment on the front end will only result in a higher quality of life for those who suffer from chronic diseases and cost savings of billions of dollars to our health care system. Just as history has judged our efforts to battle for democracy abroad and put men on the moon, we too shall be judged for a response to this critical moment in history. We truly cannot afford to fail. I yield back.
Thank you. The gentleman from Illinois, Ms. Schakowsky.
Thank you, Mr. Chairman, for moving us closer to getting where we all want to be and that's the goal of comprehensive reform of our healthcare system. I want to thank Chairman Waxman, Chairman Emeritus Dingell, who have provided wonderful leadership. This is an historic moment. Americans are counting on us for guaranteed access to affordable, quality health care, and we have to act now. People are foregoing care, families are falling into bankruptcy, businesses are struggling to make ends meet. I want to focus on two provisions. First and most important, the public health insurance option. Consumers need a real choice, and the insurance market needs real competition. A robust public option provides both. It is essential to meaningful reform. Second is the inclusion of the Nursing Home Quality and Transparency Act, no-cost legislation, which, as the title says, will improve quality and transparency, helping nursing home residents and their families. There are so many important provisions in this bill, and I look forward to moving it and at long last creating an American health care solution that meets America's health care needs. I yield back.
Thank you. Gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman. I want to thank you for holding this series of hearings on the health reform discussion draft. I'm pleased we're starting the process on addressing the issues facing the 47 million uninsured individuals in our country. There's a lot of good things in the discussion draft that I know we'll hear about and we'll talk about over the next few days. One of the issues that I'd like to point out, something I've been working on, a number of members on our committee, that the discussion draft doesn't include, and the elimination, or over a period of years, the 24-month disability waiting period for disabled individuals under 65 for Medicare. Unfortunately, once again, we leave these individuals out in the cold. Currently, 1.8 million individuals are stuck in a 24-month waiting period. Of those individuals, 39% are uninsured and 13% will die before they endure that 2-year wait. Congress deliberately created the waiting period in 1972 to keep Medicare costs down, and I believe the 24-month waiting period is a shameful example of how we refuse to cover disabled individuals whose medical treatment is deemed too costly. I've sponsored the ending the Medicare disability waiting period for 5 years, and each year we were unable to move the bill because it's too expensive. And again, in this draft, we refuse to address the issue. Instead, the reform draft would allow some of the individuals to obtain a government subsidy to purchase insurance through the exchange, and if they live through the 24-month waiting period, once they receive their disability determination, they can then switch to Medicare. Why would we want disabled and chronically ill switching insurance coverage, possibly switching physicians? And I'm not sure the exchange will provide these disabled individuals with the complex medical treatment and coverage for equipment that they need. And I strongly urge the committee not to push aside those who endure that 24-month waiting period, even after you wait to get a disability determination from Social Security, just for monetary concerns. We can eliminate that waiting period over a period of years and show that we do recognize the problems the disabled have. And I yield back my time.
Gentlewoman from Wisconsin, Ms. Baldwin.
Thank you, Mr. Chairman, and thank you to our witnesses for being here today. We have before us what is an amazing accomplishment, the work of many years of research and analysis and a collaborative effort of this diverse committee. It is difficult to overstate the importance of our task. We have been in this position before, but this time we simply must succeed. As President Obama said earlier this year at our joint session, healthcare reform must not wait, it cannot wait, and it will not wait another year. As we debate the details and the intricacies of this draft, I want to be sure that we remember the people, the children and the families that are waiting with great hopefulness for us to act. Our country is suffering under this growing burden, and it is our responsibility to answer their call. I am very pleased to see that this draft includes a public health insurance option. I have been unwavering in my support for this aspect of reform, and I believe that this plan will lead the way for reforming our delivery system, emphasizing prevention, and paying for quality. I have a few suggestions for improvement to the bill, but I look forward to working with my colleagues on moving this forward. Thank you again, Mr. Chairman. I yield back the remainder of my time.
Thank you. Gentlewoman from California, Ms. Matsui.
Thank you, Mr. Chairman. I want to thank you, Chairman Waxman, Chairman Emeritus Dingell, on the excellent work to get this crucial legislation to where it is today. I'm particularly pleased with Section 2231 and Section 2301 of the draft bill. These sections build off legislation I wrote to create a public health workforce corps and to centralize prevention spending in a wellness trust fund. Public health and prevention are critical aspects of a strong health care system. They must be part of our national strategy to control health care costs, create better health outcomes for people, and ensure that the health care system works for all Americans. Without public health and prevention, we'll never drive down health costs, nor will we move our society from one focused on treating sickness to one that promotes wellness and healthy living. I urge my colleagues to support these critical components of the draft bill before us today, and I yield back the balance of my time.
Thank you.